So how are things going? Thank you all for joining the HCM 340 live session. This session is designed with you all in mind. I am Katina Flagg, the instructor and facilitator for this particular live session. It's designed to be interactive. So I really want you to ask questions, especially because you have your paperwork, your paper that's due. If you have questions about that assignment, oh, I see. Yeah, you nodding. So take
No, I'm
full
like,
advantage to ask questions and everything. This session is really short. We have only 30 minutes here and I have another session right after this. But the real deal is, we want you all to know that there's actually real people that's grading your assignments, that we are real and we care about you. And most of us, we've already gone this road. We've done the exact same thing that you're doing. We're here to offer this support. They let we're an extension of your team. We're not just your instructors or professors, that we care. So I host these sessions twice a semester, just to get to know you guys and answer questions, especially if you have homework questions or something like that. And then I've already put a link in the chat box for at the end. It's a course review eval. So if you guys could click that link or scan the QR code. Let me see. I can share that with you at the end. So I did put that link in the chat box already because guess what? I didn't want to forget. I always forget.
yeah.
So, so Alexandria,
Yes, ma'am.
um, so are you currently working in healthcare? I just moved my camera.
Yes, I am actually. I've been in healthcare for probably about 20 years.
Oh, great. What do you do?
So I'm a surgeries coordinator right now and deal with like all the referrals too for the office and procedures and things like that. So, oh,
So you're looking to advance once you complete this program?
yes, ma'am. Actually, I've worked for a private practice for many years, and it was suggested to kind of go this route when I decided to go back to school, and said, you really need to get into management and whatnot. So, but here I am. So I'm
Okay,
excited.
great. Great, great. Since 2005, I've been in the medical field. Awesome. So Danielle, are you in like HIM? What role? What part? I was coming your way next. You must have felt me coming that direction, huh?
Of course. So I've done a little bit of a lot of everything. I've done billing and coding on the physician side as well as the hospital side. I've helped create policies and procedures for billing and coding. As far as like Epic, I've helped build some of the functionality into Epic. Currently, I'm on the insurance side of things, and I basically help put in edits for claims to deny because, why do we want things to pay, right?
hmm
Mm-hmm, mm-hmm, mm-hmm.
And that's my current role. But yeah.
Great. So far, how are you guys, navigating and matriculating through your degree plan? Do you find everything supportive? Is it anything you guys would like to see differently? Is it all working well for you?
I mean, I've been doing great. I will say that as a whole, it would be nice if more classes offered like some live events. There's been a few in other courses I've taken, but they're always at like 12 o'clock in the afternoon. And
Mhm.
so you can't get into it. And I know we've all got busy schedules and lives, but this was really nice and just wanted to jump on the opportunity to actually kind of, like you said, talk to someone. So you're not just looking at a computer screen with a bunch of words on it, you know?
Right, right, right. So, and I did put that survey link in the chat. So click on it and like you can give your feedback. My actual leader, she literally reviews those one to one. So if she gets 100, she's going to review those 100. She reads the comments and everything. She is very passionate about making sure our students have a great outcome in our program. So she's very innovative. She's always looking for ways to make the end in mind for our students. So,
Okay.
that's one good thing. Danielle, I see your
Yeah, I was about to say,
like,
I think the thing I struggle with the most, I think, is this Superior Library.
mhm.
You-
And we'll make stories.
I think that's the biggest struggle because this is like my first term with SNHU.
Mhm.
So, and I think that's the biggest thing I struggle with is the Superior Library. I think everything else is come pretty natural because I've been in the healthcare industry for so long.
I know it's a pleasant surprise that how much you actually learn from on the job, and when you can apply that, it just makes things so much easier, right?
Mm-hmm.
Yeah, and
Oh,
which also makes school harder too because you have to break the two apart. You have to
exactly.
figure
That's
out
rich.
right what
Yep.
pertains to school and what pertains to not common knowledge. And a lot of it is common knowledge to me at this point
Mm-hmm.
because I've been
Right.
into it. So it's very hard to try to find a site when they're saying to cite something when you just know the information.
Mm-hmm. And wait, I want to back up with the librarian thing. You know,
Mhm.
you can schedule, and I talk with my hands. I'm sorry, I'm a
I
little
do the
animated.
same.
You're fine.
You can schedule an appointment with the actual librarian, and
Mhm.
if you're struggling with navigating through that platform, she will walk you through. Someone on that team will walk you through so that you can get the best ease of use, because you're not, you still have a lot of more courses, and you do have to complete everything in the APA format. And so going there, getting those journals and those sorts of things can be advantageous for you. So I would encourage you to schedule like that one-on-one session or reach out so that someone can offer you the support and get you over that hump to make it as successful as possible.
Gotcha. Yeah, I
Yeah.
did do an appointment with one of them one time, and they kind of showed me some about adding the parentheses on it, like quotations.
Before
Um,
and after the term that you're looking for. So it
yeah,
narrows
and
your
use
search.
and you use and or, which I don't necessarily think it's the HCM one I'm having issues with. I think it's the history one I'm having issues with, to be honest with you.
I
Oh,
will
well, if you ask me, that's history.
Yeah, I wish I
I
could look at it
never,
like that.
that was never my subject. So I can totally relate. I don't know if it's the library or if it's just the subject itself.
Yeah. I will say,
But
Danielle, for
it's like,
me, what I found that helped me in the beginning of navigating through Shapiro Library, because it does get tricky, is I went to Google Scholar, and
Mhm.
those give you those the peer reviewed journals and all that. But it helps you to find the term that Shapiro Library will pull, which really
Okay.
kind of helped me. But you have make sure you're using Google Scholar,
Hmm.
not regular
Just
Google.
Google. Hmm.
Yeah, but it gives
Got
you the
it.
term that helped me with navigating the library at the school.
Ah, okay. I'm gonna do that.
Yeah.
Thank you.
Yep, you're welcome.
yeah. So sometimes that's another good reason to join the sessions is
Hmm.
because you learn something like that, right?
Yep.
So before, because this is HCM 340, and this week our reading is coming from chapter 11, right? And
Hmm.
it's saying improving care coordination and reducing readmissions. But in addition to that, this week I believe you have your final paper draft is due. Let me look.
So let me ask something. So what I don't understand is, okay, so when I submitted my paper, she's like, Aline was like, what is it? Focus on problems, not so much the resolution, that the resolution comes into the second paper. How would I have known that?
Okay, so when you look at your final project milestone, so you get your overview, right? And then you have like the different prompts. And we have the criteria. So and it tells you in this section what you should focus on. So the work. So this is part 2 of your final project. It says specifically the following critical elements must be addressed. So the existing initiatives. So this is the part, that you will be focusing on these elements here. And then it's a building block. So you're building your competency base. And so when in this section, these are the things you're going to address. Your gap, you're going to address the gap. What's your goal, your development, and your resource. So you have a big comprehensive approach here. And it tells you, like, for the proficiency of it, explain an existing healthcare initiative. That's the gap, like what's wrong. That was put in place to address this gap in access to quality, equity, or efficiency of care, right? So this is our paper is talking about, back to the title of it.
So are they going to want like true data, or we just have to take it off of the topics we've already submitted? I mean, the pages we've already submitted, the references.
Well, in general, like when I worked in the healthcare and I was in school, when I was in healthcare, I would use my facility where I worked because I had access to real data. Like I would just not use patient information, but I would use statistics, because you can get information from your intranet. Like, well, we had an intranet at the time, and it was hospital data. It was all of the different data, research, and all of these sorts of things. And you could have a real case, like what's the gap? So if you are looking at, we're talking about, let me go over here, week 4, back to the reading. Improving the care coordination, and reducing readmissions. Okay, so, and then it asks you, like, this is the chapter. What factors contribute to a hospital readmission? So, how can care coordination be improved to reduce the hospital admission? What are some consequences of readmission? Okay, what pre-discharge, discharge, and post-discharge strategies can be implemented, right? Mm-hmm. So these are, when you think about that from an organization, that's why Medicare created the 72-hour rule. Okay, so you know the answer, right? That's why Medicare created the 72-hour rule unless the patient is readmitted for a different discharge. So if I'm discharged with cardiomyopathy, and I come back to the hospital within 72 hours, if they treat me for something different, then my diagnosis is different. So I'm not being admitted with that same DRG. Yes, like a broken leg, or I have a fever, or I have RSV, or I have pneumonia. So that's a completely different admission. So I'm readmitted, but it's not for the same diagnosis. So this is like the type of information that they want us to talk about. So you being in healthcare, you have inside, knowledge. Okay, so when you talk about this 72-hour rule, you said you struggle with the Shapiro Library. Well, you know what research says. You know what CMS says. You know a lot of natural content. But you go get a scholar that you can take your natural content, your natural knowledge that you've known from work experience, and mesh that up with a scholastic article or journal, and then you have some supportive evidence. So you have your thing that you can actually cite, and you can say, the 72-hour rule, and some people don't even know what that is. Explain it. Give supporting documentation. Pull from 2 to 3 resources to build your case. But what are the contributing factors to the readmission? Okay, research tells us that, patients are readmitted because oftentimes because they were discharged too soon. Why were they discharged too soon? Was it related to the particular insurance plan? Why? So what does research tell you? You can go to Google, you could go on those resources, you could use text. It's a lot, but it has to be a scholastic type of article or journal or something that you can go to the WHO organization, go to those type of resources, go to major research, CMS, go to those type of things, AHEMA, go to various you know, resources to support you, different books and those sorts of things. So when you answer that question, and before you write your paper, just start putting 3 bullets, So what are factors contributing to hospital readmission? I would give myself 3 bullets. So I would just take these things and put it on a Word document. Mm-hmm. And then I would build my paper before I actually write my paper, right? I would literally just build it.
Okay. So like building off of that while you're getting that pulled up, using our personal experience in being in healthcare, I've always worked in ENT or otolaryngology. Mm-hmm. And let's say, for example, one of the big problems we find is we get older patients that have massive nosebleeds, for instance. And we have found that a lot of that's due to patients being instantly put on aspirin just because they hit a certain age. Then they're put on Plavix because they had a cardiac event. But then they're also on blood pressure medicine, and they're older, so they already have thin blood all the way around anyways. And they keep visiting the ER, which calls our doctors in, needing to pack their nose or cauterize the nose. And it's like, we can't keep doing this every couple of days when they're still on all these medicines, but their doctors, their primary care's got them on aspirin, cardio's got them on blood thinners, and then, they get put on blood pressure. It's like, no, we have found that those doctors aren't talking to each other as well. So you're saying like maybe use that experience and information to plug into research, finding those numbers on that too.
Okay, so what else? See, so I said the side effects of the meds because that's what I just heard you say, mm-hmm. And decreased provider communication amongst caregivers is what you're telling me, and because they're prescribing these meds.
But it also can be that the patient's not given the correct information to the doctor, so they don't know how to truly diagnose them.
Oh, no, for sure. I mean, we'll have patients who are like, what medicines are you on? And they were like, oh, I take blood pressure. Okay, well, that's like about 40 different types of medicines. What dose are you taking? So they don't even realize that you've got to narrow it down and be very specific. And, we're in the Epic Care system too, but patients, I think sometimes, especially our older generation and our very young ones, they think that just because you're Epic, that it's Epic everywhere. Whereas one hospital has their own Epic and another one has their own Epic, and you have to get permissions for those 2 Epics to communicate.
Exactly. So, okay, so look, this is just me just throwing. So mm-hmm. This is what I would do. Before I start writing my paper, I would do this. And then I would say, so what factors contribute to hospital readmissions, right? Mm-hmm. Right?
Yep.
All right, so then I will come and say, how can care coordination be improved to reduce hospital readmission? Because we already said right here, look, right? Mm-hmm. So then now this section, you're gonna tie that in because consults, you know. So
Mhm.
we already said that this second thing and the first thing is hard to do with the second thing. So the provider consults, you know, we need to address provider consults, right?
Mhm.
Right. What else? What else is a contributing factor?
All right. Let's see. How can care coordination be improved to reduce hospital admissions? Well, and I think better post-op or discharge instructions. I don't think patients always understand kind of their
Education,
mm-hmm.
proper
What you say?
communication.
How to read them?
Yeah, proper communication education, like she was saying.
Yeah,
Because they don't understand what the doctor is actually telling them.
correct. Yes. I mean, like we did a survey in our area, and I live in a rural town. So, and they averaged like the reading and comprehensive level of the majority of our community is about a fourth to fifth grade reading level. And so when you're discharging, like you were saying earlier, Danielle, a lot of this is second nature to us because we've been doing it for so long. But these patients don't get half of the words that are in their discharge information or the importance of it. You know,
Mm-hmm.
following up with your cardiologist or following up with after a procedure when you're in the hospital.
Which also leads to transportation. They may not have the transportation needs to get to the hospital, especially if you're in a rural area, because there's one part of our state that is in a truly rural area that there's not doctors within, I think the limit is 10 miles or something like that.
Mm-hmm.
So they don't have the transportation means. And in order to do that, they have to get a referral to get a transportation.
Mm-hmm.
Okay. So now we have 3 bullets here, right? But then you would take all this stuff and help you go do your research. So
Okay.
you see, before you start writing your paper, you're just trying to gather your thoughts, right? And then what you know, it's always important to include some type of statistics.
Okay.
So when you do your research, what stats, you know, what
Mm-hmm.
stats are you going to include? Who, from where, you know?
Okay. Include stats. Okay.
You know, statistics. You should always have like 20%, you know, do that research. And then another thing, what I see students, I always used to include some type of data um in my writings. I will include graphs, you know, because you're building your case. Like you want your instructor to know that you understand. And not only right now you're completing these assignments because you just want to grade, right? You want to finish your degree. I want to pass this class. I want to be done. But I'm going to tell you this. Once you go sit for your RHIA or your, you know, whatever credential, you are not going to believe how much your recall is going to come to when, and that's why I think it's always important to include statistics, some type of data.
Okay.
It makes your documentation rich. I put graphs in my, when I used to write my papers for school, I would put graphs and all of those sorts of things in my research papers. And so this is how I would tee it up. This is pretty much starting to be my outline, you know. But I don't see anything about CMS yet. Like, what are contributing factors? Is it any CMS guidelines? You know, what's the, you know, so what about CMS? What about regulatory bodies, you know?
Mm-hmm.
You know, consider that. Make sense?
Yes.
What are the consequences of the readmission? So what are some of the consequences of readmission?
Well, you got the first one's financial. You know,
Okay.
for patients. I mean, you got these patients, they end up with these massive hospital bills that they can't afford because
But
they
what
keep
about from the hospital perspective? We denials, or if they readmitted within 72 hours
it,
and it's the same diagnosis, the hospitals don't get paid any additional revenue.
exactly. Well, and that's what I was going to say
Treatment.
too. Yeah. On top of if the patient can't afford it and then they're not paying their portion. I mean, the hospital ends up eating. We had a patient who was considered a non-compliant patient, and he kept getting readmitted for his A1C being out of control. And so you got the cost of he kept getting admitted for going into diabetic shock and all this kind of stuff. And come to find out, he just couldn't afford his medicine. So then it was creating a program at our hospital where there was options for patients to be able to get discounted diabetes medicine there so they could afford the medication, which was a whole lot cheaper for the hospital to eat some of those profits in diabetic medication versus constantly bringing in this patient to get admitted, the staffing, the bed, the testing, and all of that. So, sometimes there's ways to for the hospital to even kind of work with maybe pharmacies or doctors.
I mean, overall, there is a rework for everybody. It's not just one department.
Mm-hmm.
So the patient's inability to afford medications, the insurance denying us. So you see how I'm building a foundation of this paper before we get started? Mm-hmm. Then you go back and you research all of these and you bring in your, scholarly resources. Mm-hmm. And then you meet your APA, you have all your content, and then you write your paper.
Mm-hmm. Yep.
So, and then it's not as hard to write the paper because you have some foundation here, right? So you're thinking about what your problem is, that gap. Remember we saw, so we identify what the gap is, and then we build from there. Okay?
Mm-hmm.
So did y'all find this helpful?
Very much.
Yes.
Well, I think also like Danielle and I kind of put it on the chat on the side. I'm like her, I can go down a rabbit hole 100%. And once I get an idea and then you find 50 different articles and they're 30 pages each and you're trying to read it all. So doing it this way, I think will help kind of narrow that in and get you kind of more streamlined versus having this one big thought that you're trying to force into this small amount of time.
Yeah, you're trying to push that circle into that square peg.
Yes.
Yeah, so I was doing mine on veterans, and oh my, I went down a rabbit hole with all kinds of different databases, and I was just like, do I need this information? I finally had to stop.
Yeah, and so, but at least this kind of keeps you on track, right? If you do it this way, and then you have a big idea of how to write your paper. And you don't have to stay in that little bitty, if it's like 250 words or something, because you don't ever know what you're going to learn in doing these assignments and how it's going to impact you later. Mm-hmm. I remember when I had papers, I went back and I would keep all of my papers, but I could go back and reread those documents and be like, oh, and it helped me with something else. Now you can't reuse a document because that's plagiarism. Mm-hmm. Even if it was your work, you have to start over from scratch. But at least you have a foundation of that information and some of the research, and then you have like the authors and all of those sorts of things that you can go reference material from those books. That's what I found it very helpful.
Okay.
Mm-hmm. So we kind of detour from a lecture, but it's okay. And, but this is what it's for. So I'm glad that you guys found it helpful. Shamik? And Ashley, thank you all for joining. Do y'all have any questions before we jump off? I have another lecture for HCM 345 right after this within the next minute or so. This is the QR code and the survey. If you guys will please complete that. And I enjoy interacting and seeing that smiling face and just learning a little bit about you. Ashley, anyone to round robin, any questions, comments, or concerns before we conclude tonight's session?
Thank you for your time.
No, thank you for joining. Y'all just reach out. I have something going on in the chat box. This was cool. I really enjoyed engaging with you all. It wasn't just, straight from a lecture, which make it better because we shared content, knowledge, and we grew, right?
Mm-hmm. Yep. No, definitely appreciate the guidance and direction. So.
All right. Did you all get the UR code?
Yes.
Yes.
Whatever that thing is called. Please.
Yes, I got it.
All right. Well, thank you all for joining. See you all next time. I'm going to run off and deal with the next group, and hopefully we have a great session there as well. Thank you. Reach out if you need anything.
All right, we'll do it. Thank you.
All right. Y'all have a great one. Bye-bye.